Cervical exams in the hospital, SVEs, checking your cervix. These are all the things. People have so many questions about what they're for and if you can refuse them. So we're going to talk about that today. I'm Hillary. I am the pregnancy nurse and I'm the curly head behind the website Pulling Curls. I am also the creator of the online prenatal class for couples. Here at the Pregnancy Nurse, we aim to prepare you from bump to bassinet for your confident collaborative hospital birth. While you're here, I would love it if you would like this video and subscribe so that you tell YouTube you are interested in great high quality information about your upcoming birth. Today we are talking about cervical exams, and that means when they put their hands in the baby exit area to see how dilated you are. So that's what a cervical exam is. So why do we do cervical exams? So the main reason we do them is to check how far you are in labor, which doesn't always matter. If your doctor's wanting to check you in the office early on and you don't care and you haven't felt a lot of contractions, you may want to refuse that. And there's absolutely no reason why that shouldn't be okay. However, a lot of women really want to know like how far along they are, and it helps give them peace of mind, and that's okay too. We are also checking to see baby's presentation, which means which part is headed to the baby exit area. Is it a head? Is it a bum? It could also be a hand or a foot. Anyway, we're just checking to see what's coming down. Now we can do that with an ultrasound. It doesn't have to be done with a vaginal exam, but nurses are actually not accredited to do ultrasound, so it's our fastest and best way to know if it's a head or a bum. You can also do what's called Leopold maneuvers on the stomach, but the best way to know beyond an ultrasound is by feeling it with your hands. Finally, we do it to just make sure that everything's okay. When your water breaks, there is always a chance that the cord can come out, and a lot of times if we're not seeing the baby doing well, we'll come in and we'll check your cervix to make sure that nothing is in the birth canal. That could be an arm, that could be the cord. So that's something else that we use those types of exams for as well. Now, some people are completely fine with these exams. They appreciate that their doctor wants to know and they like the information that they get from it. However, a lot of people want to refuse them, and that's completely fine. You may feel that they are unnecessary. Like I was talking about in the doctor's office, actually when I was pregnant with my last baby, they checked me at every appointment from 28 weeks on, which now in retrospect was completely useless and a waste of my time to take my pants off because I knew I wasn't contracting and I wasn't concerned about preterm labor. Now, if you are having some contractions at home, you may want them to check you because that's the easiest way to know that if your cervix is opening maybe a little bit too early. But I wasn't having contractions and I knew I was going to go overdue, so it didn't matter to me. You may also have a history of trauma, and we understand that a lot of people in that area have very strong feelings about how things go down there. So if that is the case, definitely tell your providers. Please don't be shy about that. You can just term it as something, I've had a history of trauma in that area and I'm very sensitive and I just wanted to let you know. That is a lot better than trying to like beat around the bush about why you don't want the exam. It just makes us more understanding about where you're coming from, and communication is always the key, right? Now, I've seen a lot of people on the Tickety Talk say you can refuse vaginal exams whenever you want, and I guess you can, but I'm not sure why you're coming to healthcare providers if we can't do a simple test like a vaginal exam to help you out and find out how things are going. There are a few times that you really do need to have this exam, so I'm going to go through those right now. If you are your cervix is not opening, you've been in labor for a long time and things have kind of stalled out, we may just want to see where your cervix is at. There are ways for us to tell that baby is progressing and your cervix is opening without checking your cervix, but a lot of times we just want to see what's going on down there if you're laboring for a long time and it doesn't seem like anything's changing. That can be an important time for us to just check and see how things are going. If your cervix is swelling, a great practitioner is going to be able to tell a lot about your labor and the progression of your labor by checking your cervix, and that's really the best way for us to do it if things have stalled out. Like I said before, if baby's not looking good on the monitor, there's a good chance that we're going to want to check your cervix, and you should be okay with that. If we come in and say baby does not look good, we need to check to make sure that the cord hasn't fallen out, a hand, things like that. Or if baby is close to delivery, sometimes baby doesn't look so great on the monitor then, but it's really important that the nurses are able to check your cervix at that point in time. So just be prepared for something like that. If you are needing or wanting to get induced, it is really important that we check your cervix before we induce you so that we can choose the right medication for your induction. I actually have a few videos here on YouTube talking about Cytotec and Cervical and ways that we can induce you, so you can check those out. But if you're less than 3 centimeters, we're gonna wanna pick something than if you're different than if you're more than 3 centimeters. And the only way for us to really do that is to do a cervical exam. Okay, finally, when you come to the hospital saying that you're in labor, we really need to check you because we need to know that you actually are in labor. The definition of active labor is that your cervix is actively opening, and the only way for us to know that is by checking it. Now, if you have a history of trauma, you can talk with your provider about them not checking you when you come to the hospital, but that's something you're gonna need to start a conversation in advance, because that provider is going to need to alert us to that with your prenatal records so that we are aware that they are okay, that we're not checking you, and that we're just gonna kind of like expectantly monitor things and see how things are going. Again, communication is key. So if these are things that you really don't wanna have happen, tell your nurse why. It is not gonna be surprising. You are not going to be the first one. What's worse for the nurse is for you to have a really hard time when we're doing things and we have no idea and we don't know how to help you. So by conversing and telling us the things that make it better, reasons you wanna refuse it, it just makes everything so much easier for all of us. If vaginal exams are something that you don't love, side note, nobody loves them, although by the time you have more babies, it is a little bit easier. Make a plan about what you're gonna do when there is an exam coming up. First off, like we've said all along, make sure that you're telling your providers what is an issue for you, what you would prefer to see done, all those different kinds of things. So make sure that you're communicating with all of your healthcare team about what you need. Now, this isn't saying that you need to have an explicit history of what or why or all those different kinds of things, but it is saying that you need to let us know just some basics so that we can help you the very best way that we can. One of the other things you can do is to put your fists underneath your bottom when they're checking your cervix, or we can put you on a bedpan. That helps raise up your bottom, and a lot of times it makes your cervix a little bit easier for us to find. So that is a thing you can do to help make the exam just a little bit easier. A lot of people, when they're early in labor or early in their pregnancy, the uterus is tipped and the cervix is further back. But again, when you raise those hips, it kind of moves it forward, and it's just easier for us to reach and easier for you to tolerate. I have a post about difficult exams, and one of the things that a lot of people have said on that post is to wiggle your toes. And actually at my last pap smear, I gave it a try, and it totally does help, because when you wiggle your toes, do it right now, it's really hard to keep things stiff down there. One of the worst things you can do is tighten up all those muscles because you're scared. It makes it harder for you, it's harder for us. So the more you can relax, the quicker we can get it in and out and done, the easier it's gonna be for you. The final thing is just to, like I said, relax and take deep breaths and to practice those relaxation techniques at home. It might help for you to have a meditation that you listen to, or words that you can go through in your mind. Obviously, you're not going to practice the exam at home, but just going through it in your mind and staying calm can really help you if you've had issues with having it done. So those are my best tips if you are getting a cervical exam. If you liked information like this that can help you be more confident in the delivery room and communicate with your healthcare team, be sure and like this video, and I would love it if you would subscribe. Thanks for visiting. I know we have a lot of other videos coming up that you are gonna like as well.